So Dr. Barr, I just want to say thank you for the kindness of letting us visit and talk to you a little bit about StayClear. So
My pleasure.
what do you think are some of the features and benefits that you like about this?
With above all, I think the first thing is the illumination factor. It has created an incredibly good feel for myself as a dentist and my assistant without making shadows and a lot of other issues that we have had with other products. I thought I was going to be a little bit hesitant with the weight of the product and everything. It turned out to be very balanced and everything. I still would like the wand to come a little bit higher, and you guys have worked on that, and I think that's going to be a critical factor. There's really minimal weight on my left hand with the mirror. Secondly, so well designed the angle of the mirror that the retraction factor and the illumination gets amplified significantly when you're working in the mouth. The fact that you're able to generate airflow to the mirror, it helps tremendously in the process of not slowing you down when you're prepping a tooth or teeth. So that has been a really, really good thing. I was a little bit hesitant in the beginning about the light due to the fact that most of the products used in dentistry are photosensitive. So for that, it really has not been an issue whatsoever because I'm able to put it to the side and grab a regular mirror, condense to whatever I need to do, and then my assistant switches with me mirror. So it really has not been an issue. It took me a while to get used to it, how to function, but if I don't have it, I miss it. I love the fact that now my assistant really knows what I'm doing, can see the size of whatever I'm doing, the amount of material we may need for whatever procedure. So overall, it's good. I've been trying it also with surgical placement of implants, and it's actually working much better than I thought it would. I do have to spray it every so often, but really it does the same thing, and it illuminates, it's able to allow me to discern things that before I had to completely stop and re-angle myself. I like to do four-handed dentistry, both arms supported, and it's really, really been conducive to following that trend that I have done for the last 20 years, basically.
How long have you practiced dentistry?
Graduated in '91, so that will make it 25 years.
Wow, you look younger than that, sir.
Thanks, appreciate it.
What, when I came originally, you had told me a story about the impact to the ergonomic positioning, how it affected you, how you used to get different pain strains and back pain, and how this affected sitting upright as a dentist.
Excellent question. Unfortunately, we all have really bad habits. About 15 years ago, I was introduced to the chair I'm sitting on right now, and it forces you to sit in such a position that you have your back fully loaded ergonomically. And by using the arms, it has really eliminated me having to switch in positions that were really not good for my back. So historically, before this, I had to get a massage possibly every 7 days.
7 days. Wow.
Because it got really tight. So now, since I switched to this, I have not. I was a little bit concerned with the new line. Was I going to go back to that routine? And actually, it turned out to be even better because now with the movement of my hand and good fulcrum, I can illuminate in a way that before I could not do with an over-the-head lamp or the ceiling mounted lamp historically used in dentistry. I no longer use my forehead or my lamp or my loops because with this instrument, I don't need it. Simply as that.
Wow. What do you think about the illumination value of the StayClear device?
The source of the light is terrific. It gives you an incredibly good hue, therefore you don't seem to have distortion of things that before you could with other lights. Yellow lights tend to obscure your ability to discern the depth of decayed cavities and so on and so on. At least it did for me. With this, I can really, really see well, distinctively hard soft tissue, both disease and non-disease. So it's helped tremendously. It's a much brighter light.
What would you change about StayClear?
The only thing I will change is the quality of the mirror. The mirror has a little bit of a fogging effect, and it's a little bit hard at the beginning, but you kind of learn to deal with it. If that could be improved so you don't have to deal with that, I think it will be tremendous improvement in the product.
You had given us a great idea to also add a type of lifting device to lift the umbilical cable, which we are going to incorporate into the device as an option.
Yeah, I think that will be the best way to eliminate any potential weight problem in your left hand if you're left-handed, or right-handed if you're right-handed. So you have a good balanced fulcrum without having to strain your wrist. Yeah, I think that will help tremendously.
You had told me one time in reference to younger dentists that use headlamps that I was intrigued, not being a dentist, but an inventor and a marketing person and an engineer. Um, you explained to me that dentists will wear the headlamp and crane their neck and the headlamp light into the oral cavity. Can you talk a little bit about how, with that repetitive motion, how that impacts the body of the dentist, the neck, the strain on the eyes, the neck, the back, etc., please?
The problem I noticed when I used the headlamp is it was easy for me to control or move my body to a position that was not natural, so I can get the illumination wherever I need it, because either I did it directly from the lamp or indirectly through the mirror. So that would always force me to have an odd position. I noticed that a lot of young dentists are using them is because really, historically, we have not had a good source of light in dentistry. We had a good light from the outside, but it really never got into the cavity well enough to illuminate what we wanted to see well. With this device being inside the mouth already, illuminating the cavern of the mouth in a good hue, good tone, it eliminates completely the need for you to bend in an awkward position or uncomfortable position in a long-term process. And now you can go back at treating the patient with reflective mirrors in a way you've always been taught to do. Four-handed dentistry, really.
Terrific. What about the impact to efficiency, the ability to see better, to do better, to be more? You had once chastised me about the use of the word makes you a better practitioner.
Yeah, that was good. I tend to use that a lot. Efficiency is really, quality of the product that you provide to the patient or the service is not reflected in the equipment that you use. It's really who you are, what do you want to accomplish. What it can make you be more aware of how good you are or how poor you are is the ability to see what you're doing. With scanners, with reflected good quality lights and everything, now we can see things before we couldn't. So really what it does, it eliminates the guessing, in my opinion. So you now really know exactly your ending or doing what you want to do or you always wish to accomplish. So the illumination has provided that in a way that I've never been able to do before.
Do you like that the optical head is disposable once all the different features and benefits are impacted on the prototypes? The ability to quickly dispose of and have a fresh new mirror for each patient at the right price point. How valuable is that?
It's incredibly valuable. Infection control, or being able to keep an area sterile, disinfected, is achievable in multiple ways. But when a patient's perception that they see that you're getting a brand new clean mirror that comes in its own sealed pack, you open it in front of them and you put it into the system so you can have the illumination that you wish, it is a huge factor. I think dentistry has changed from bulk to individual wrapping for that particular reason. It makes it perceivable by the patient that you are doing and going above and beyond what the public duty is. The pricing is something that it has to be worked out because everything has to have a cost and everything. My opinion is if you make it affordable, people will use more often. I would rather pay for the equipment a little bit more and have a little bit lower price in the pieces that you have to replace continuously, because it will make me want to use it more and more and more.
How about the impact to your assistant team and your hygienists, and have some of them made comments about StayClear, the value of the light, the impact to them?
Oh, my assistant says for the first time she was able to see exactly what I'm saying. She said before she kind of knew or guessed what she was supposed to see, but now she can see it. She uses a mirror also to see herself and retract, and being able to physically see and understand what I'm doing makes us do what I perceive a better quality process for the patient.
One of the things that I've noticed in human nature is it's very difficult to get people to try something new and different. Is StayClear different enough with the value of offering enough features and benefits to encourage the trial, the use, the experimentation with something new and different like StayClear?
Oh, absolutely. You're right. Dentists tend to be really hard-headed about that. We tend to stick to our views, and we don't want to go out of that. This is not so much as technology. What it is a way to do things better because you can see better. Simple as that. Just like magnification loops are part of dentistry today. I personally don't wear prescription lenses, but using loops makes me do what I feel a better job for the patient. In conjunction with the light, it's just exponential in benefit.